The reproductive system is a collection of organs that work together for the purpose of producing a new life. Infertility, inability to become pregnant. Painful periods. And fibrosis, non-malignant tumors of the womb. Impotence, a problem getting or keeping an erection. Also as female infertility, the inability to achieve a pregnancy in a fertile woman due to low sperm production. Inform with the doctor and check that everything is alright with your organism.
Gonorrhea. This disease is caused by a bacteria. Symptoms of gonorrhea, like pus discharge from the genital tract, heartburn, and frequent urination. The disease-causing bacteria can spread throughout the body, causing pain in the joints and can lead to infertility. Treatment of gonorrhea. The disease can be cured if treated with antibiotics quickly. Prevention. Avoiding sexual activity. Having sex only with one uninfected person. Consistently using male latex condoms during. Genital herpes. Herpes is caused by a virus, genitalis. The virus that causes herpes is herpes simplex genitalis. Symptoms of herpes genitalis. Onset of itching or pain in the genital area in the presence of crystal egg athlete and open wound or battery blisters. Genitalis herpes treatment. Patients are usually treated with antiviral herpes and vitamins to strengthen the immune system. Therefore, patients should rest until the wound dries herpes and complaints body ache subsided. Period of rest for about 2 weeks is also necessary to prevent recurrence of the disease. Prevention of herpes genitalis. Immunization with varicella zoster vaccine and not make contact with the herpes sufferers.
My name is Carlos Arispe. My partners are Liceo Oviedo, Salma, and Elisa Cordero. Here I am with Dr. Lorian. We will be having an interview about the reproductive system. Doctor, what is the main function of the reproductive system?
Well, basically we have the main function of the system is look at what is called reproduction. That is the whole reason it's called a reproduction system, is to reproduce human beings.
What are the main parts of the male reproductive system?
Well, the main parts generally consist of what we call the testes, prostate, and the urethra.
What is the main function of those parts?
Well, basically the testes or the testicles. Their primary function is to produce semen. The prostate, in change, is to produce an alkaline fluid, that would help the semen run fluidly all the way through, upwards and down through the urethra. That is the function of the urethra.
Which are the most common diseases in the male reproductive system?
Well, some of the most common diseases that we have depend basically on age. But if you're talking generally, we have from cancer, penile cancer, prostate cancer, but hydrocele, which is when it starts to inflame, varicocele, which is when the testicles start to inflame. Those are basically the most common that we have in the male.
Well, now we're going to talk about the female reproductive system. How is it conformated?
Well, the female reproductive system is conformed by, we have a lot of going inside. We have the main entrance is the cervix, uterus, ovaries, and fallopian tubes. See? The primary entrance is called the vagina.
And what is a stem cell?
Stem cells are the biological cells that can divide into specialized cells. You can have specialized cells for different tissues, for different organs. These are very, very important, and basically what we use when a child is born. I guess you've heard about the different stem cell laboratories that we have. And you can take a stem cell that is specializing into any kind of organ. It can be bone, marrow, heart, kidney, or anything, and it'll specialize into that. That is what a stem cell is.
How many weeks does the gestation last?
A gestation period is conformed of 40 weeks. We have women that can go to 42. The average birth is around 38 weeks.
38. How many ovules mature in average?
On average of a cycle, we have about 20 follicles that'll reach it in what we call a cycle, which is about 28 to 30 days. We have about 20 a month.
And what about the menstruation?
Well, a menstruation is usually the end of a cycle. A menstruation is when the follicles or ovules does not reach conception. They begin to clean what we call the uterus.